We do not let coronavirus take out spirit. Dr. Alex George says medical staff are sticking together and staying positive to beat the pandemic. Dr. Alex George has admitted he is trying not to let the coronavirus break him as he shared a sweet picture standing with his hospital colleagues on Wednesday. The A&E doctor, 30, flashed a smile as he posed with another doctor and a paramedic in front of an ambulance at Lewisham Hospital in London. The Love Island star has been keeping his followers updated with posts while working during the deadly coronavirus outbreak. Dr. Alex, who recently praised the work of NHS nurses, flashed a beaming smile while posing in his scrubs with a stethoscope hung around his neck. Revealing his positive attitude, he captioned the image, "Yes, things are uncertain and times are tough, but we do this together with positivity. We do not let coronavirus take our spirit. Keep smiling and stay strong." Last month, Dr. Alex honored the nurses working during the crisis in another touching Instagram post. The reality star said that nurses are the backbone of our National Health Service. Dr. Alex took the time to chat to a group of nurses about their experiences on the front line in his latest YouTube video, which he shared on social media. The reality star shared a picture of himself standing with 3 nurses outside the emergency department while praising them in the caption. He wrote, "Nurses are the backbone of our NHS and vital on the front line in the fight against the coronavirus. Despite everything they are facing, they continue to look after their patients with care and compassion. In my latest video we hear their incredible stories. Link in bio." Following his social media post, Alex appeared on Thursday's episode of Lorraine where he discussed his concerns over NHS staff's mental health. He told host Lorraine Kelly, "We're seeing a lot of sad things, we see it normally but not on this scale. I can definitely see how this will build up for a lot of people." Dr. Alex revealed he had spoken to colleagues to gauge their opinion, and said, "It was really interesting to speak to staff and see how they're coping. The feedback I got was that there's ups and downs, you see things that affect you." He added, "But ultimately seeing these things day in day out have an impact on your mental and physical health." Lorraine asked Dr. Alex how he was coping personally and he said, "Yeah, I have had some difficult times, I'm quite open. I've come home in tears at some of the things we see. I'm happy to speak to my colleagues at work." Speaking about his coping techniques, he said, "We have a wellness room, if you need a bit of time. I can speak to my colleagues, friends, and family, and my girlfriend has been amazing. I've spoken to her about some things." He also paid tribute to his patients and said, "Patients are also amazing, they are so grateful for our help and that can bring a warmth." However, Dr. Alex did also discuss the positives of the job, and said, "Cases I've seen, patients I was really worried about then went into ICU. But I followed their journey and they went home, there's no better feeling than that. We've worked as a team to get people home to their families." Dr. Alex discussed the pressure that doctors and nurses feel to keep working and dealing with trauma, as he predicted a PTSD crisis in the future. He said, "If you have burnouts in the coming months, if you don't address those things, I hope any colleagues watching feel comfortable enough to reach out. Nationally, I think we need to think these are unprecedented times, but we need to focus on people who really need the help as there will be problem with PTSD." He explained, "I think for doctors there's a mentality of kicking the can down the road when it comes to mental health.